Thank you. Today is Talk with Bill. Let's get started. Today is April 11th, 2020. Today is Saturday. We're going to get things going, and we just want to welcome all our guests out today. We're having a fabulous time this morning. We're going to be doing today's topic is going to be dedicated to the coronavirus. I want you guys to sit back. I'll be back in 2 and 2, and we're going to get started a little bit. Just enjoy yourselves. All right, folks, I'm back. Yes, this is the Talk with Bill show. Today is April the 11th, it's 2020, and today's topic is the coronavirus. We're going to be doing an overview today. We're talking about some symptoms, some prevention, some treatment. We're going to also be talking about what's going on out here in the news, statistics going on with the coronavirus. I mean, right now, folks, I know some of you guys are worried about the stimulus check, but more importantly, this thing is killing us off. I want to say us as people, as a whole. Right now, what we do know is coronavirus is better known as COVID-19 kills, and is currently destroying our community across the globe. Folks, right now we have 87 new coronavirus death cases in Massachusetts. There's nearly 1,900 new cases in that state. You also have Russian hospitals are hit by a huge influx of coronavirus patients. This is out of the New York Post. NBC News talks about hospital workers on front lines of coronavirus. They find their tires slashed. I mean, they're helping and they're finding their tires slashed, folks. We're getting out of control. Listen, right now I'm coming out of here in North Carolina. This is a statement that's made by the North Carolina Department of Health just recently about the coronavirus. This is in response to the disease in 2019. Now it says COVID-19 case count. Now listen to this, folks. This is interesting because people think this just came about, but this is actually came about back in 2019 November. Now some of us are thinking, we have some cases there where people are thinking, okay, you know what, the government's after us. Maybe so. Some of us are thinking it was a bat that carried the disease, and somebody ate the bat, or somebody got bit by the bat. Maybe so. The question is, for that particular person that believes that, the question I have for them is, how do you think the bat got it? I mean, after all these years, Chinese people have been eating bats. It's been known they've been eating bats for over 100 years. And all of a sudden, this disease pops up in the bat, and now we can't control it. So is it possible that the government put this out? Maybe. I don't know. Is it possible that a bat actually bit into a person, human being, and had the disease already contracted in it? Maybe so. I don't know. Is it possible that 5G has to do with this? Maybe so. I don't know. But today, folks, what we're going to talk about is the main thing that is so. What is so is that today, the coronavirus, better known as COVID-19, is killing people. It's destroying our communities, folks. And we gotta figure out what we're going to do about this, okay? I know some of y'all are saying, well, John, there's nothing we can do. Yeah, it's something you can always do. Something you can do is you can figure out what you're going to do, and that is, how can we help? Now, what's going on today, what we need to really worry about is how this is affecting our community. I mean, it's affecting our community over and over and over. We got to really figure out how we're going to get this thing to work, in a matter of what I mean by this is a matter of just helping people out. Right now is a time, folks, where we really need to be prepared for what's going to happen. We need to, work with each other. We need to calm down. We need to express our love for one another. This is a time, folks, a lot of people haven't even been in a household with their families this long. It's amazing because some of the people out there they just do not know how to be in the house with their families. The liquor stores are lined up, and I understand that people want to take a drink because, hey, if you're in the house with somebody you don't want to be in the house with, you might need a drink. You might need a smoke. I don't know what it is you need, but you might need something. And I get it. But this is the time really to reflect on, man, what God has done for you in your life and in your family's lives. And then reflect on what can you do for somebody else. Folks, listen, one big thing that we need to all do, keep your butts at home. Okay? If you don't have to go out for anything, keep your ass at home. I said it, keep your ass at home, okay? Because there's no need for you to be going out possibly giving somebody else the disease or possibly contacting the disease. We're messing around with money, we're messing around with foods, all these things can be bought in bulk at one time and you don't have to go out. Now, I get it. Some of you have to go to work. We get that. If you have to go, you got to go. Obviously, because if you're waiting on the stimulus check, that check is nowhere near to be found. Folks, I'm guaranteeing you, that's nowhere near to be found. You're not going to see that for a while. But what I can tell you is this: is that the time is getting near, and the biggest thing is that with this coronavirus, we just have to look into what is the next step. Now, so let's kind of dive into what we're going to talk about. First of all, we just want to mention some things because I want you guys to know this is Talk with Bam show. This is April 11th, 2020, and we want to make sure that we want to make you guys aware. So first of all, we're going to go over some of the symptoms tonight. Now, one of the things is symptoms is people may be sick with the virus for 1 to 14 days before developing symptoms. We do know that the most common symptoms out here of the coronavirus disease, COVID-19, which are a fever, is tiredness, and dry cough. Most people, about 8%, recover from the disease without needing special treatment. More rarely, the disease can be serious and even fatal. Now, older people and people with other medical conditions such as asthma, diabetes, or heart disease, they may be more vulnerable to becoming severely ill. Now, what you want to do is people that, if you're experiencing a cough, a fever, tiredness, difficulty breathing, a severe case, you need to contact a doctor immediately. Folks, I would say contact a doctor immediately. Now, those are some symptoms, Now, we want to talk about a little bit about prevention. The biggest part of prevention is stay home. It saves lives, folks. It helps stop the coronavirus. What you want to do is stay home as much as you can. You want to keep a safe distance from people. You want to wash your hands often. You want to cover your cough. And if you're sick again, like I said, you want to call ahead. These are some things you can protect yourself, folks, and help prevent spreading the disease, or rather the virus, to others. If you do wash your hands frequently, and they want to say regularly for 20 seconds with soap and water or alcohol-based hand rub. You want to cover your nose and mouth with a disposable tissue or flex elbow when you cough or sneeze. You also want to avoid a close contact, folks. They say about 1 meter or 3 feet with people who are unwell. Now, the basic, it goes back to the number one area and way to stop it is stay home and self-isolate from others in the household if you're feeling well. They say don't touch your eyes, don't touch your nose, don't touch your mouth if your hands are not clean. These are just some prevention tips that can help you. One of the things, though, if you do feel sick, folks, there is really no specific medicine to prevent or treat coronavirus disease, which is COVID-19. People may need supportive care to help them breathe, folks. Right now, the self-care they have going on is if you feel mild symptoms, stay at home until you've recovered. You can relieve your symptoms if you actually get rest and sleep and you keep warm. They want you to drink plenty of liquids, and they also talked about, and what I thought was really interesting is using a room humidifier or taking a hot shower to help ease or sore your throat, or cough. These are some areas that you can actually help with your self-care. But again, there's nothing at the time that it specifically will prevent it. So it's a deadly disease, folks, and we want you to be safe. I want to give a couple of things before I go into what people are thinking. So the news on this, right? They're talking about, coronavirus patients reporting strange new symptoms. Who's investigating? We got live updates. The U.S. surpasses Italy by so much. Cuomo urges caution and rush to reopen New York. We got stuff, man, over and over. New projections show social distancing is helping slow down the coronavirus. Man, there's restricted coronavirus zones in Jerusalem. I mean, this list is going on and on. This world is going on and on. But let me tell you what's going on right now. Right now, the new cases are confirmed cases reported since the previous day. Right now we want to do North Carolina, it's 257 as of April 9th. If we look at the United States, folks, the United States, let's look at this serious. Nobody in 95 in Algeria right now. As of April the 10th, it's 95 cases in Algeria. In Argentina, we want to look at some place, it's 81. I mean, this is hit all over. Let's go to Bangladesh. Bangladesh is 94 as of April 10th, folks. I can go on and on. To Belarus, let's go to Belarus. It's near Belgium. It's 495 as April 10th in Belarus. Let's go to Australia, folks. In Australia, there's 100. There's 100 cases in Australia. Let's pick on Brazil. Let's look at Brazil. In Brazil, there's 1,781 cases as of these are people, new cases that confirmed, reported since the previous day. That's in now worldwide, folks. Worldwide, let's look at cases worldwide. Worldwide cases confirmed is 1,765,030. Recovered is 401,323. But we've had 108,000 deaths since in the United States. So we're talking recovered. We've had, that's total. So 20,000 in the United States, 16,000, a little bit over 16,000 in Spain. Italy has over 19,000. Germany has 2,800. You have France with 13,000. List goes on and on. But the lowest is Turkey, folks. What are they doing over there? The lowest is Turkey. They only have 1,100 deaths, folks. And so obviously they're doing something we're not. They have recovered. They have totally confirmed. The lowest right now is 52,000. So something they're doing over there that we're not doing, folks, and we need to find out what they're doing. Now, let's move on. Okay? Let's move on to what the heck is really coronavirus? Who made it? Who created it? How can we fix it? Well, I'll tell you. I don't know the answer. I do not know the answer to that. Let me tell you this, though. What I do know is this. It's a problem, and we need to solve it quick. And there's ways that you can solve it and help solve it by keeping your butt at home. I'm not going to say it anymore, folks. Keep your butt at home. You know, one of the things is that, we've had deaths before. We've had, listen, AIDS hit the epidemic center. It hit the whole world with the epidemics, and it just hit people, and people died off. We had SARS. We had the flu. We had the whooping cough. We had the Agent Orange. We had all these different things, folks, that have been going on in life and have been killing us off, right? We're a nation of survival. We're a people of dignity and strength. We're a family, folks. We're the USA, United States of America. We can get through anything there is to get through. But we all need to come together. Black, white, Hispanic, yellow, green, red, brown, wherever you are. If you're in whatever country, you need to come together. Yeah, sure, there's been some knuckleheads in other countries saying this and saying that. And yeah, sure, we've had some leaders in the top parts of the White House saying some crazy stuff. Yeah, sure, we've had some Congress say this and say that. But the bottom line is, folks, overall, we are a good people. And overall, we can get through this mess if we try. Folks, I'm only here to give you some information, to give you a little buzz, to give you a little wake-up call. You have what it takes to make this thing happen, folks. Folks, make it happen. Again, this is your boy Bim, Talk with Bim, and we want to thank you for showing up.